Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Intrathecal-morphine-pump-placement. Introduction. Severe pain can greatly limit your ability to move and work. The pain could be due to cancer, injuries, or other diseases. If other treatments fail to control the pain, placing the drug morphine around the nerves in the spine may relieve the pain. A morphine pump placed in the body can be very effective in controlling the pain. Healthcare providers may recommend surgery to place a morphine pump in the body of a person suffering from severe pain. If your healthcare provider recommends surgical treatment for your condition, the decision whether or not to have surgery is also yours. This program explains intrathecal morphine pump placement. It explains the symptoms and causes of severe pain. It also talks about the benefits and risks of intrathecal morphine pump placement. Anatomy. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is made of solid sections of bone called vertebrae. Nerves travel from the brain through the spine to the legs and all parts of the body. When the brain gives orders to body parts, these orders are carried through the nerves. These orders travel by electrical impulse in the nerves. Pain is one of the feelings that travel from all parts of the body to the brain through the nerves. Pain is not felt until the pain impulse reaches the brain. Morphine stops the pain impulse from reaching the brain. If the pain impulse is stopped before reaching the brain, you will not feel pain. Alternative treatments. A morphine pump is recommended only when the pain is severe and cannot be managed by regular medication, back surgery, or other treatments. This type of treatment does not help in all cases. Before doing actual surgery to implant a morphine pump, your healthcare provider will give you a test dose of morphine through a spinal tap. This test is done to make sure the morphine helps in reducing the pain. It also makes sure that you can tolerate the morphine without any nausea or allergic reaction.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Surgical treatment. The operation can be done under either local or general anesthesia, depending on your healthcare provider's preference. The pump will be placed under the skin of the abdomen and connected to the spine by a tube called a catheter. First, an incision is made in the middle of the back. A catheter or flexible tube is inserted from the back incision down to the spine. X-ray pictures are used to find the best place to insert the catheter. To place the morphine pump, the second incision is usually made below the rib cage in the front. Your healthcare provider may recommend a different location for the pump. The morphine pump is placed under the skin in the front. The spinal catheter is tunneled under the skin. It runs from the incision in the back to the incision in the front. It is connected to the pump at the incision in the front. All incisions are closed at the end of the operation. The whole system is under the skin. It may not show at all under regular clothes, but it may bulge under fitted clothes. Risks and complications. This operation is very safe, but there are several risks and complications. These complications are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, chipped teeth or cut lips, sore throat, headache. More serious complications of anesthesia include heart attack, stroke, pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they can cause shortness of breath, chest pain, and possibly death. It is extremely important to let your healthcare providers know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep in the spine or abdomen or at the skin level. 2. Bleeding. 3. Skin scars that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Spinal fluid may leak from around the nerves and cause a headache. Infection called meningitis may occur around the nerves and spinal cord. If you notice high fever, headache, and extreme tiredness, call your healthcare provider. There is a small chance of general weakness or even paralysis. There is a slight possibility of bowel or bladder dysfunction, but this is rare. Other risks specific to this surgery are related to the use of a mechanical device. Catheters may pull out of place or break and have to be replaced. The pump may stop working or become infected and have to be replaced. The battery lasts a few years, after which the entire pump may have to be replaced. In rare cases, scar tissue can form at the tip of the catheter around the nerves and spinal cord. This scar can become big enough to put pressure on the nerves or spinal cord. It can cause pain, weakness, and possible paralysis. In these rare cases, surgery is often needed to take that scarred tissue off the nerves and the spinal cord. The body may get used to gradually higher doses of morphine. It is important to only use the lowest possible effective dose. If the body gets used to more and more morphine, the drug may stop being effective in controlling pain. The longer a person expects to use the pump, the more important it is to keep a dose low. After the surgery, no repetitive bending or twisting or heavy lifting is allowed in the few weeks following the operation. After resting, physical therapy may be necessary to allow you to resume your previous activities. Whether or not you will be able to resume all previous activities depends on how well you are doing at the time of your follow-up. Your healthcare provider will tell you how long it will take before your back is healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors. The pump needs to be refilled with morphine every few weeks, depending on how much of it is used. The pump is entered with a special needle through the skin. Refilling does not hurt, but there is a small needle prick. The pump can be programmed from the outside to deliver the desired amount of morphine to the nerves. It is important to always use the lowest possible amount of morphine. Your pump has a low volume alarm which will go off when it stops working. It also goes off when the pump needs to be refilled with morphine. When the supply of morphine to the nerves is cut off, you may have withdrawal symptoms. If you hear the alarm, have worsening pain, or feel suddenly upset or nervous, call your healthcare provider right away. You should tell your family to call a healthcare provider right away if you become too sleepy and difficult to arouse. You may be having an overdose that could be deadly. When you pass through a metal detector, you may set off the alarm. It is important to carry your registration card with you to prove you have an implanted medical device. You should tell all your healthcare providers that you have a pump. This not only includes doctors and nurses, but also chiropractors, physical and massage therapists, pharmacists, and other healthcare providers. Some treatments and procedures may be dangerous for people with a pump.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Severe pain can greatly limit your ability to move and work. Morphine pump placement can help relieve your pain when other treatments fail. The pump will be placed under the skin of the abdomen and connected to the spine by a tube called a catheter. The whole system is under the skin. It may not show up at all under regular clothes, but it may bulge under fitted clothes. This operation is safe with good results, but complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.